Good afternoon, my name is Annette McGrew. I'm doing a presentation today on childhood vaccinations. Protecting our children and others should be an important factor in our lives by getting our kids vaccinated, which protects them for various infection diseases which can cause medical health problems or long-term health problems or possibly maybe a child facing death. Vaccinated children tend to be less sick than children who are vaccinated. Getting our children vaccinated protects them from various infection diseases. It cuts down doctor visits, cuts down medical costs, it cuts down funeral costs. It causes children to have a long-term healthy lifestyle from childhood as they transition into adulthood. Children are not being vaccinated because parents fears the side effects, or it being linked to cancer, or religious beliefs, or they're afraid of the actual medical costs. People are actually afraid of vaccination side effects. They're afraid of, once again, it being linked to cancer, or a child developing autism, a child developing brain tumors, a child developing high fever, soreness, internal damage to organs. President Barack Obama spokesman stated, "Decisions is really clear. Some parents continue to debunk research linking vaccines to autism and refuse to vaccinate their children." This was reported by Nidra Pickler. White House science indicates parents should vaccinate children. Another source, Robert Kennedy Jr., stated, "All of the studies shows the primary reason people don't vaccinate their children is the mistrust of regulators." So parents don't actually trust what is being put into the vaccines. What is actually being put into each vaccine is the actual weakened vaccine, or a weakened part of the actual infection or virus. And what that does is, once it's into your immune system, it attaches itself. So in case you're a child or as an adult you come in contact with someone who has it, you have a less chance of catching it from that child or that adult. Parents are also afraid of cost. They're thinking that, oh, it's expensive, it doesn't cost me thousands of dollars. Actually, getting a vaccine is actually free, and it's covered by a federal program called Vaccines for Children. And children who come from low-income families is free at no cost. Vaccines are also covered by insurance. So as you see, it doesn't hurt you to go get your child checked out. You can also talk to their local pediatrician. Their local pediatrician will be able to explain to you vaccinations, how they work, what they protect them from. If your child have any other issues that could be concerns with the vaccines, and at that time you can discuss it with your doctor. One of the great things about vaccines is that they help eliminate future outbreaks. They protect your children from getting any infection diseases. They also keep your children from spreading to other kids in public or private places. They also could possibly be eliminators for all the outbreaks. If you think about it, if every child was to get every vaccine, when their future generation comes, they won't have to worry about like mumps and measles and chicken pox and rubella and DTaP. These are some things that can cause some serious damage to our children if they're not vaccinated. Parents, vaccinations are free and funded by a federal government program. Vaccinations have been around for centuries, because back in the days, from the centuries, we have like mumps and measles and rubella that's been coming around when we first originally started the U.S. And at that time back then, they didn't really have the proper medicine or the proper doctors or the proper antibiotics or the tools or anything to actually be able to cure. So we have a lot of young children, a lot of adults that lost their lives because of that. But getting them protected today against these infection diseases and all these new vaccinations that are coming out that are offered can protect them from actually catching those diseases in the future, and also can protect our children now. Think about it. Every year that we look around, every year that we turn around, new vaccines are being introduced. And the reason new vaccines are being introduced because new infectious rare diseases are actually occurring in the U.S. Some are coming from other countries. Some are being developed in the U.S. and getting transferred over to other countries. So if you don't want your child to go to like Italy or Romania and catch something over there, and you don't want your child coming in contact from a child who just recently coming in from another country and wind up being sick, reason being they don't have the proper medicine, or they was never vaccinated, so your body is not originally immune to the actual disease. Okay, Vaccinators can eliminate all future outbreaks. Vaccinators can protect your child from getting sick. Vaccines can have immunity, just like chickenpox. I'm medically immune, so I've never had it. I could never explain the pain that a child would feel, nor do I want my children to experience it or explain the pain or watch my child suffer from that type of vaccination. So yes, my children are protected against chickenpox. The rate of non-vaccinated children has slowly decreased, but is still on the rise, and there's still a possible chance of kids facing health or long-term health problems, or even possibly facing death. Outbreaks are on the rise. Nidra Pickler reported in the article White House Science indicates parents should vaccinate their kids that approximately 100 cases was reported in the U.S. last month, resulting in the second biggest outbreak. Wow. Could you imagine how many parents were sitting in the hospital to hear that their child had something that could possibly cause a long-term health, or something that their child could probably battle for a long time, or something that could have been prevented had their child been vaccinated? Lizzie Tanner reported in Measles Cases Turn Attention to Bounty of Children Vaccines article that an average in 2012, more than 4 million people and at least 100 deaths occurred due to non-vaccinations. Imagine that. That's like 1 out of every 4, or 4 out of every 100, or 4 out of every 1,000 child or adult that was actually sitting in a doctor's office hearing that, oh, because you didn't get vaccinated, or because you're not immune, or you're not protected against this, here's the disease and here's the side effects. Also, another big thing is the actual increase in children's deaths. A lot of children are actually dying because parents are not getting them vaccinated, or parents don't understand the consequences of not having a child vaccinated or the benefits of vaccination. So a lot of parents are not sure what's going on with their child until they go to the doctor, and then at that point it's too late. In 2010, the U.S. Department of Health and Human Services reported that the U.S. had over 21,000 cases of whooping cough and 26 deaths among children and infants to age 6. Can you imagine that? Can you imagine how many parents have to live with the fact that their child has something that they didn't understand, or their child could have something that could be prevented? It's called a DTaP. The DTaP is amazing. It's like 3 or 2 vaccines in one. And the whooping cough is called pertussis, and that is a very killer among young infants. So parents, please, I advise you, when your doctor tells you about these immunizations, please get your kids vaccinated. The increased rates of infection diseases is on the rise. Every year a new disease is being introduced. Every year a new disease is coming out. Sometimes these scientists and sometimes these doctors don't know everything, and they have to study for it. But then you still have to worry about the diseases that have been here and around for centuries. Children's, infants, and toddlers, their deaths are on the rise. Their long-term health issues are on the rise. What are we going to do about it? How are we going to protect our children? Parents, get your kids vaccinated. Each year, something is being new, something is being introduced. Each year, you're hearing about a school or a hospital that's having a huge, or a public or a public outbreak, because we're not getting our kids protected with vaccinations. Children being vaccinated protects them from infection diseases, protects them from death, protects them from spreading, or protects them from catching from other kids or other students or even adults. It also provides immunity in case something occurs, like, once again, chickenpox. If you don't get the chickenpox vaccine as a child, then when you grow into an adult, it turns into shingles, which is very painful. No one wants to go through or suffer through that. Parents, protect our children. Get our kids vaccinated. Protect other people's children as well. You cannot go to school or enroll your child in school without having your child fully vaccinated. Think about all the medical costs. Think about all the doctor visits. Think about everything that you're going to be cutting time and saving money on because you protected your child. Think about all the preventions of the long-term health issues that could be prevented if you just vaccinate your child. Stand up and fight and believe. Don't be afraid of the side effects. Once again, there are no side effects. It's not linked to cancer. It's something that could be immune. It's something that could prevent your child from having future health issues. It also can prevent you from bearing your child and prevent funeral costs, and medical costs. So I say stand up, get your children vaccinated, go down to the local doctor's office today, learn about these vaccinations, protect our children. Have a great day. My name is Annette McGrew, and once again,